Good evening, everyone. We are excited about today's conversation. Come on in, come on in. Hello to those who are logging in to Facebook. Hello to those who are logging in and viewing us on YouTube. Since you guys are here, take that link and share it. Go ahead and send it to, somebody in the community, your sister, anybody that has a child under the age of 18. Go ahead and share the link and say, hey, we have some good conversation going on. So we are live. We are live. We appreciate your presence today. So as folks are logging in, I would just like again, good evening, everybody. We're happy to have you. We're going to have a really great conversation today. So get your popcorn, grab your drink, your Starbucks, your Coke, and let's be informed by today's conversation. We are again super excited to have our guest speaker. We are excited to have you. Happy holidays to everyone. Hope everyone is staying safe and being well. And we're going to start probably a little after 7:05. So again, text, share, like, um, let somebody else know. Say, hey, we got a good conversation we're going to have. So come on in. All right. You see folks are logging in. Thanks, folks, for getting on and being timely in today's conversation. Again, happy holidays to all. We are going to, again, we're just waiting for a couple more people to log in to join us. We want to make sure we can expand our audience. So again, I task everyone to, take the link that you joined in and go ahead and send that and share it with somebody else. Make sure you're also providing comments, whether you're on Facebook or on YouTube. Make sure you're subscribing and following us on all our social media platforms. We're extremely excited to have you with us today. Awesome. We are seeing people logging in. Thank you guys so much. Thank you for your patience. We just want to give it a couple more minutes, let a couple more folks come on in, and we'll go ahead and we'll start today's conversation. Dr. Hamid, while we're waiting, let's just do an audio check really quick. Make sure you're okay.
Yeah, can you hear me okay?
Sound great. You sound
Perfect.
great. Thank you. All right. I see folks are logging in. Go ahead and again, text your cousin, text anybody you know that has a child under the age of 18 and say, hey, this conversation's for you. It's for us. Awesome. Awesome. Well, it is 7:05 and we are not going to belabor the time. We're going to go ahead and start. So, good evening, MGE parents, guardians, friends, and family. We are excited to have today's conversation. I think it's a very timely conversation For those of you who this may be your first interaction with you, we welcome you. And we just want to start off by telling you who we are. So, Manage Emotions, Avoid Negativity Girls, Inc., affectionately known as Mean Girls Empowerment, is a 501c3 organization serving the greater Chicagoland area. Our organization aims to prevent bullying and teaches our girls how to identify bullying behaviors. We strive to empower young ladies to live a positive and healthy lifestyle and to achieve their personal best. So, Mean Girls Empowerment is the only Chicago based program dedicated to tackling bullying by educating girls. Our mission is all about empowerment, to avoid negativity, to build up self confidence, and to pursue their goals through perseverance, courage, and creativity. So, again, on behalf of Shatina Edwards, our founder and CEO, our board of directors, our MGE staff, we would like to welcome you to today's live discussion entitled Access, Awareness, and Acceptance. My name is Kenitha Johnson, and I serve as the Director of Membership and Volunteer Services with Mean Girls Empowerment. In my day job, I'm a Senior Director of Quality, Safety, and Health Policy with a trade organization that is responsible for helping guide our first responders through the COVID-19 pandemic. So, as we know, again, this conversation could not be more timelier. Daily, we are seeing the COVID cases skyrocket nationally across the state, whether you're listening to the radio or seeing things on the news. As a community, we have been greatly impacted by this pandemic. I don't think anybody does not know at least one person that either has had COVID and unfortunately that may have passed due to COVID. And we got so many things happening right here in our state. I just heard a statistic that it says one person every 3 seconds nationally with the new variants are receiving COVID. Recently, Mayor Lightfoot and Cook County Board President, they announced that individuals over the age of 5 are required to show proof of vaccination in most indoor public places. That means restaurants. That means you, parents, as you go to the gyms and you matriculate through the city at museums and other places. And this is not only isolated to the city of Chicago, but this is Cook County and suburban Cook. So the impact has become so much greater. So what we wanted to do here at Mean Girls Empowerment is inform our community of the impacts of COVID-19 and talk about the COVID-19 pediatric vaccination. We want to spend this next 30, 40 minutes and we just want to have a discussion. Talk about the science. Talk about how to ensure we can stay safe, that we can gather again, that we can appropriately, move through life. Remember, this is a no judgment zone. We will be taking questions throughout today's conversation. So put those questions in the question box, whether you're on Facebook or YouTube. We have people that are watching out for those questions. And we want to go all the way to the 8 o'clock hour. So send those questions over to us. And we have a wonderful speaker lined up for you guys today. So Dr. Amira Hamed, Dr. Hamed is not only an emergency medicine physician that sees this firsthand, but she's the assistant EMS director for John H. Stroger Jr. Hospital. She's an assistant professor of emergency medicine at Rush University, a faculty member at the University of Chicago, and she is also very passionate about ensuring our community is informed. And she's the equity advisor for the Illinois Medical Professional Action Collaborative team. So without further ado, I would like to turn the presentation over to Dr. Hamed for her to give us the science, to talk through it. And again, as she's talking, when those things spark your interest or spark your mind, go ahead and put those questions in, and we want to be able to address them a little later on. Dr. Hamed, the floor is yours.
Thank you for that introduction, Ms. Johnson. I'm really excited to be here today. I have a lot of information to cover with you all. I'm excited for those who have joined us, and hopefully we can get through some of your questions and provide you all with some data that's useful in making a decision about whether or not to get vaccinated and whether or not you'd like to get your child vaccinated. I did put together a slide deck for you all. It's going to be about a 40-minute presentation, and then we'll follow it up with Q&A. So I'll go ahead and slide on over and share my screen. Okay, Kenitha, is it sharing now?
Yep, it's coming up now. It's loading.
Perfect. All righty, can you see it now?
Yes.
Perfect. Okay, so again, I'm Dr. Amira Hamid, and today I'm going to talk to you about COVID-19 vaccines in children. Sorry if you hear my dog in the background. Gamby, pillow. Okay. I'm the equity advisor for IMPACT, which is the Illinois Medical Professional Action Collaborative Team for Healthcare, and today is December 29th, 2021. So as far as my disclosures, I have no disclosures. I have no financial interests. I don't get paid by any of the vaccine companies to talk about their vaccines today. I'm here on a purely voluntary basis because I care about health equity and I care about our marginalized populations all throughout the Chicago area. About IMPACT, Illinois Medical Professionals Action Collaborative Team. So we're actually a coalition of physicians and healthcare professionals that are working together to inform the public and advocating for our communities and Illinois health professionals throughout the state. And we do that by using data or evidence-based solutions in order to impact practices and policies that impact the communities that we care for. A little bit about me. I'm a double board certified emergency physician. I work out of Cook County Health on Chicago's west side. I completed medical school at UIC, or University of Illinois at Chicago. And then I did a 4-year emergency medicine residency program at Cook County Health. After that, I went to Denver Health and did a 1-year EMS fellowship and signed on as assistant EMS medical director for the Chicago West EMS system, providing medical oversight and medical direction for the Chicago Fire Department and a smaller agency called Hodzala EMS. My academic interests include health equity, implicit bias in medicine, social justice, and EMS. The goals of this talk, so like Ms. Johnson was saying, this is a safe space, so ask whatever questions you may have. Some of the goals are to provide information on COVID-19 and vaccines, discuss some of the concerns about the vaccine, answer any questions that you all may have to the best of my ability, so please don't throw tomatoes at me if I don't have all the answers. And then also to foster respect. Most of my family is vaccinated. However, I have family members that are very close to me that chose not to be vaccinated. And I respect them. I respect their decisions. I respect them as individuals, and I respect our community and what they do and what their beliefs are. But today is about educating you or providing education to you. And then at the end of this talk, I'll provide you with a list of resources. That way you can look at the COVID vaccine information a little bit more on your own. So jumping right into COVID, so a bird's eye view from the CDC website. So up to, from the entire pandemic, we've had 52 million people affected by COVID-19. Over 800,000 people have died so far. And over the last 30 days, we've seen the cases of COVID-19 increase significantly. The good news is that more than 3/4 of our entire nation is vaccinated with at least one COVID vaccine. So that's at 77.6%. The bad news is our community transmission is relatively high, with nearly all of the United States being in the red zone, as you see on this map here, which shows that the community transmission is high in those areas. This week in Illinois alone, if you look at Google, you can Google this today. I just repeated my screenshot for this morning to make sure the information is most up to date. So this is a graph of all of the COVID-19 cases since the pandemic began, with March 16th, 2020 being the first noted cases for the entirety of the pandemic. And you can see we've had these waves of the different variants that are coming through, and the different summertime activities and winter activities and holiday celebrations that have caused waves in COVID cases. But what I want you to look at is the very end of this graph. It's just December 28th. So just yesterday. So we actually broke the record for the entirety of this entire pandemic in Illinois, with the most COVID cases that we've seen in the state of Illinois. If we look at the timeline of COVID-19 since the outbreak began, the first cases were seen in Wuhan, China, back in 2019. And then in March of 2020, basically that's when the United States started shutting things down. And we pretty much knew at that point that things were more serious than we had thought that they were going to get. But then we saw a light at the end of the tunnel, where in December we had the first emergency use authorization for the Pfizer COVID vaccine. And some of the first medical professionals got those vaccines. I was one of the first vaccinated at my hospital. And then December 18th, we had a second vaccine that was approved for emergency use authorization, the Moderna vaccine. And then this year, early in February, there was an emergency use authorization for Johnson & Johnson, the COVID-19 vaccine, for use for a COVID-19 vaccine. And then we saw the Delta variant this summer. That variant really kind of took over, and we saw a significant increase of cases and hospitalizations with that variant. And something we also saw is a few breakthrough infections, was a little bit concerning. And then for the rest of the year, some of the big highlights are that Pfizer actually got full authorization for patients 16 years and above, and then filed for and achieved emergency use authorization for kids from 5 years up and above. The very last thing that the CDC lists on their COVID-19 timeline here is November 26th, the World Health Organization classified a new variant called Omicron. So Omicron initially made up just a few cases here in the United States. Of course, there were none at first, then there were a few. And over the course of 1 to 2 weeks, it became the most dominant variant here in the US. So this is what's been breaking the news over the last couple of weeks, which makes this presentation very timely by Mean Girls. On December 4th, you can see that it made up very few of the cases of COVID-19. And now by December 18th, it made up at least 70% of all the cases that we've been seeing throughout the United States. Some of the news that we've seen, some of the news headlines from this week alone. So these were pulled just 2 days ago from NBC5 Chicago. Illinois is seeing the highest surge in COVID cases since the pandemic began, Top Doc says. Illinois top doctor addresses rising pediatric hospitalizations amid the COVID surge. And even in New York, COVID hospitalizations top 5,000 for the first time since February. Admissions among New York City kids soar. So we're seeing not only a rise in cases, but a significant rise in pediatric infections secondary to this Omicron variant. So Mean Girls has invited us today, Impact, Illinois Medical Professionals Action Collaborative team, to inform you, provide access to an expert opinion, and to empower you to make your own decisions about the vaccine. And of course, again, we're just sharing information here today in a safe space. So jumping into it, so a disparity in COVID-19 cases was noted when the pandemic began, a couple months into the pandemic. A disparity is defined by Merriam-Webster as a noticeable and usually significant difference or dissimilarity amongst groups. So what we found is that when you look at the cases secondary to COVID and deaths related to COVID, we saw that Native American or Alaska Natives, Black, and Latinx populations remain disproportionately impacted by COVID-19, where when you look at the cases, if you're American Indian, Alaska Native, or Latinx, you're 1.6 times more likely to have contracted COVID than white counterparts. And if you're a Native American, Alaska Native, you're 3.3 times more likely to be hospitalized here. If you're Black or Latinx, 2.6 times versus 2.5 times more likely to be hospitalized. And as it relates to deaths, you're more likely to die from COVID-19 if you're American Indian, Alaska Native, followed by Latinx, followed by Black or African American. So these are health disparities. And the CDC actually notes that race and ethnicity are serving here as risk markers for underlying conditions that affect health. And those are secondary to socioeconomic status, access to healthcare, exposure to the virus, et cetera, and so forth. So what is the root cause of these disparities? So we're often taught a lot of times, in school, medical school, residency, that it's due to individual life choices. So it's your decision to smoke. It was your decision to drink. It's your decision to eat unhealthy, or it was just built into your genetics. However, the root cause of these disparities is actually inequality. So we see unequal access within Black neighborhoods and Latinx neighborhoods, Native American neighborhoods. We see unequal resources and in general, unequal life chances. So with unequal access, some things that we see is that people don't have the same access to insurance. so they can't afford this insurance, or the hospital around them doesn't accept their insurance, or the clinic doesn't accept their type of insurance. You may have a lack of neighborhood physicians or a lack of neighborhood clinics or hospitals in general. You may also have a lack of or limit in transportation to get to those hospital clinic or clinic visits. And your ability to afford treatments or prescriptions that were prescribed to you may be compromised due to lack of socioeconomic income. And then unequal resources. So if you look at Chicago, it's, you go to the north side, flourishing in resources. There's a place to wash your dog, right? There's a gym. There's nice parks outside with benches and everything else. There's healthy food. There's grocery stores everywhere. When you go to some of our south side and our west side neighborhoods, or neighborhoods where there's more minoritized populations, what you find is that there aren't healthy food stores. In fact, there are things called food deserts where there's no health food store in sight. Instead, you have a corner store that sells chips, pops, things like that, things that are not healthy or not designed to keep you healthy. We have a paucity of health complexes, and our neighborhoods may not be as safe. The walkability of our neighborhoods may not be comparable to some of our neighborhoods up north. And we also see unequal life chances within some of our neighborhoods, with there being discrimination within hiring or promotion, having unequal educational opportunities where public health systems are funded very well in some neighborhoods and not funded very well in others. There are lower rates of dual family income, secondary to mass incarceration and other etiologies. And we also see unequal housing, where a house on the south or the west side, may be 5,000 square feet and be worth only half of a house that's half that size on the north side. We also see adverse childhood experiences. So we have kids in our neighborhoods that are exposed to trauma, unlike things that a lot of us have ever seen. And those adverse childhood experiences shape their outcomes later on in life. And then we like to think that we all provide great healthcare here in the medical field, but there's actually hard data that shows that some patients get unequal care and are not treated equally as the person next to them. And that's secondary to something called bias in medicine. So we'll talk about a little bit about that a little bit later. So the root cause of these disparities is inequality. And that's secondary to something called social determinants of health. So social determinants of health are basically the term that we use in medicine to talk about these differences secondary to our social stance in life. And discrimination, I just wanted to point out here, discrimination is listed as its own social determinant. However, discrimination affects your economic stability, right? Your ability to get hired, your ability to get promoted. It affects your neighborhood and your physical environment. There's been historical redlining. There's a difference in housing or ability or access to housing. There's a difference in your education, the food that you have access to, your social context, and the healthcare system, as I just discussed. And that contributes to changes in your life expectancy, your mortality, your morbidity, and basically your life chances overall. So when we look at Chicago, here's our population distribution. So what we see is on the northwest side, we see in southwest side and very south side, we see that's where majority of our Latinx population lives. On the west side and south side, that's where most of our Black population lives. And then on our very far north sides and downtown area, that's where most of our white population lives. So Chicago is one of the most segregated cities throughout the United States. And what we see is that with that segregation comes a segregation of income. And what we've seen over the last few decades is that segregation in income has increased. And the middle class is basically disappearing here in Chicago. So our poor neighborhoods are getting poorer and our rich neighborhoods are getting richer. And that's the poorer neighborhoods are here in the dark orange, and the rich neighborhoods, or the more economically stable neighborhoods, are in the blue here. And you see that blue becoming darker and spreading wider, and that orange becoming darker and spreading wider as well. So the difference in the resources in our different neighborhoods are so great that your life expectancy varies greatly based on where your location is in the city or your zip code. So when you're looking at the data, what you find is that the life expectancy here out in Streeterville, right here next to Navy Pier, is 90 years old. So if you live in that neighborhood, you have access to the resources in that neighborhood. then you're going to live to 90 years old. That's the average life expectancy. But if you live here, down here in Inglewood, one of our South Side neighborhoods, the average life expectancy is 60 years old. So there's a 30-year life expectancy difference based on where you're positioned in the city. And that positioning in the city is basically a marker for your social economic status, and then your social upward mobility in life. So this data is similar. So the life expectancy data is similar to when the data when you compare infant mortality rates. So we see that infant mortality rates are higher within our Black and other minority neighborhoods. Hospitalizations and death are higher due to cancer, heart disease, stroke, asthma, you name it, for our minority populations. So these are what are called health disparities. So the differences in health amongst different populations. And although they are significant in their own right, they're exacerbated by a broken trust by the medical community. And what I mean by that is not only are there health disparities due to our social status, there's also a lot of distrust of our medical community secondary to harms that were done to us, and harms that are continually done to us. So this is a really good read. It's a free read. It's the New England Journal of Medicine published this article, Beyond Tuskegee, Vaccine Distrust and Everyday Racism. So it harps on some of the historical racism in medicine, Henrietta Lacks in the use of her cells without permission, the continued use of her cells without permission, the Tuskegee syphilis experiment, et cetera, so forth. But it also harps on how every day Black Americans and other minorities within the United States go to the doctor and they feel discriminated against. And not only do they feel discriminated against, there's actual data that shows that they are discriminated against. So when you look at some of the headlines over the last 2 years, what you'll see is Physicians Weekly published a report, non-white patients get less pain relief in United States emergency rooms. There are several reports of the same if you Google it. There are several studies that look at Black patients, that look at Latinx patients. When they're looking at fractures, if patients come in with fractures in the same bone, you're less likely to get pain medications if you're Latinx or if you're a Black patient. And this is secondary to maybe conscious or unconscious bias by some of the treating physicians. USA Today published a study this summer. Black babies are more likely to survive when cared for by Black doctors, study finds. And then Chicago Sun-Times published, Mercy Hospital's planned closure is a stark example of structural racism, because what we've seen is that hospitals and the neighborhoods that serve our underserved patient populations have been closing at an alarming rate and leaving those populations with no medical care or uphill barriers to face when they're trying to get medical care. So Chicago really is a tale of two different cities. Just like a lot of the urban cities throughout the United States, I think the story is the same when you look at them as a whole. But during the pandemic, there were hundreds of doctors that basically protested and asked for the CDC and the government to release race and ethnicity data for COVID-19, because at first that data was not released. And what they found was exactly what they thought they would find, is that most of the deaths were going to occur within our minority populations. So April 7, 2020, Chicago Tribune actually published an article where 68% of the COVID-19 related deaths in Chicago were found to occur amongst the city's African-American community. And that really illuminated racial disparities of the pandemic in the United States. And that data held true for a lot of other cities throughout the US. Also during that time, there were a lot of Black Lives Matter protests, protesting the deaths of George Floyd, Breonna Taylor, and many others. And that really led to the CDC rethinking its pandemic response to include a health equity framework. So that focus on health equity is what put those vaccines within our Black neighborhoods, our Latinx neighborhoods, is what made Lori Lightfoot really want to put vaccinations in the hands of the people that were suffering the most from the disease, is because of this health equity framework. So this is an illustration of equality versus equity and the difference between the two. So equality means that you're giving everybody the exact same resources in order for them to be successful in life. So equality, everybody gets the same box, to be able to see this ball game in this picture. Equity means, takes into consideration that everybody is starting at different footing, right? Because there have been years and years of discrimination and barriers to people starting or to get to equal footing. So taking those barriers in mind, equity actually takes those resources and gives people not the same resources, but gives the resources that they need in order to have equal life chances. So that's something that we strive for, and that's called health equity. So the vaccination rollout and everything about this vaccination was very equity focused. And I did want to remark that a lot of people felt uncomfortable about that, right? Because how, when has healthcare been targeted towards, Black populations or Latinx population? When have people cared so much about us doing well? And it kind of felt very uncomfortable. And I just wanted to make note of that and say that's because people are trying to right the wrong that have been done and that continues to be done amongst some people that look like us. So that's the reason that that's there. So with that being said, I did want to share my personal thoughts on the vaccine because I didn't think it would be, great to give a presentation and not talk about my personal thoughts. So up until about 1 month before the vaccine, even though, again, I am a board certified emergency physician, I did not feel comfortable about getting the vaccine. Again, me and my friends were all physicians. A lot of us are Black women. There's about 6 or 7 of us in a group. And all of us, were very uncomfortable with getting the vaccine. We all said we weren't going to get it. But then about a month leading up to the vaccine, when we're looking at the data and the Black population being really ravaged by what's going on, and by the Black population having so many of those comorbidities that are scary for you to catch COVID-19, we felt like this is our best shot to right the wrong that's been done to us throughout history, and to really get off of that road of inequity and onto a road of equity. So I ended up getting my shot. I was one of the first to get vaccinated. I've gotten my 2 shots and my booster. I was probably the first in line to get my booster as well, giving me my superpowers to fight COVID-19. And I did that because I wanted to keep myself and my loved ones safe. And when I say my loved ones, I mean my immediate family, my brothers, me, my mom, my dad, and my 1-year-old daughter. So now let's talk about COVID-19. So how does COVID-19 spread? So COVID-19 spreads through the droplets through the nose. So basically, most of your droplets, when you talk, you have these small droplets that come, mucus that come out of your mouth. I think you've heard the saying, say it, don't spray it. Well, when somebody sprays you, that's droplets coming from their mouth, and they're landing onto your lips, onto your eyes, into your nose, and those are your moist mucous membranes, and those droplets can basically be absorbed into that tissue, and that virus can infect you that way. So that's the reason that the CDC says stay about 6 feet away from people, because at 6 feet, those droplets fall from gravity, secondary to gravity, and they hit the ground instead of splashing onto other people's face. That's also why the CDC says that you should wear masks to capture your droplets or decrease the spread of your droplets. And if you have on a mask and a person across from you has a mask, then that decreases the transmission greatly. So the droplets, they can be inhaled or into your body if you touch your eyes, nose, or mouth. So remember to wear your mask, wash your hands, and wash your 3 W's. So the COVID-19 incubation timeline. So it can take up to 14 days for you to have symptoms of COVID following an exposure. So this is a infographic of Sarah. So Sarah went to work and was exposed through a coworker. Coworker was asymptomatic, or maybe the coworker was symptomatic, but neither her or her coworker had on a mask. So the coworker's droplets landed onto her face. And she felt well. She got tested on day 6 because she planned to go to a party. Her test came back negative. So she went to this holiday party and she saw about 10 family members. Now, 2 days later, she developed symptoms and she then tested positive for COVID. Because she went to that party 2 days before the symptoms started, she was infectious at that time. She didn't know it, but she was contagious, and she infected all 10 of her family members. So that is exactly how COVID has been spreading so rapidly. And like Ms. Johnson said at the beginning of this presentation, the numbers have really skyrocketed so significantly over the last few days. And this is how it happens. I mean, people are asymptomatic, or they have very mild disease or very mild symptoms, and they think maybe it's just allergies or maybe it's just a scratchy throat. And lo and behold, it was COVID-19. And now you've exposed some of the most vulnerable family members that you have, or people that you really care about, which is unfortunate. So the best way for us to protect ourselves are face masks. So masks, well, one of the best ways. So the masks when you're putting them on your face, make sure your nose and your mouth are completely covered. And the mask, you want to make sure that it fits snugly. You don't have any gaps on the side. You also want to make sure that mask has a nose wire, because if it has a wire, you don't have to keep touching it to pull it up. And it kind of sits on your nose and sits on your face to keep it still. And then you can also use a mask filter to increase those layers of protection to absorb those droplets instead of you expiring them onto people. When you are picking a mask, you want to pick one with layers to keep in your own droplets and keep other droplets out. And then keep in mind who shouldn't wear a mask. So anyone less than the age of 2 should not put a mask on, or anyone who can't remove that mask on their own should not wear a mask either. So if they have any type of disability keeping them from putting a mask on, then the CDC says that they shouldn't be wearing one. So improving protection. You can improve your protection if you have a beard by trimming that beard close to your face. You can also improve protection by using a mask fitter. So that's something that goes over your mask to kind of pull it to make it fit a little bit more snugly around your mouth. And then you can also improve your protection if you put a disposable mask underneath a cloth mask, if you're using a cloth. Disposable masks are the best masks, well, the better masks that you can use, those disposable ones that you buy from the store. The cloth masks, some of them don't have many layers. You don't want just to use a single layer cloth mask. That's probably the worst type of protection. That and a handkerchief or a scarf, those are all basically about the same. So what you want to do is put a normal mask, a disposable mask underneath that, and then put your cloth decorated fun mask on top if that's, your style. Some special mask considerations for children. So masks come in adult size and they also come in children size. So you want to make sure that you get a specific child size mask for your kid. And if there are any gaps on the side, what you can do is you can make a knot right outside the mask and put a loop over the ear, and that will pull the mask a little bit closer to their face so they'll have a snugger fit. Make sure that the mask fits snugly. And then also, again, don't put it on a child that's less than 2 years old, and make sure that you're supervising your child while they're using the mask. And if they ever fall asleep, take a nap or what have you, you can go ahead and remove their mask just to make sure that they're sleeping safely. Some of the masks that you want to avoid are those that are made of restricting material. So a lot of times I like how this infographic has a lady with the cool shades because she's so cool, because she's got this, clear mask on. And I love those because you can see people smile again. And it's like, oh my gosh, we're socializing for real. And those vinyl masks, though, they don't really, you can't breathe very well out of those. And they're going to constrict your breathing. So you don't want to wear those unless the person you're talking to is deaf, hard of hearing, or needs to read lips to be able to hear or to understand. Those are the only times that you want to use a clear mask. You also want to avoid masks that have valves or vents on the side, that circular little vent, because when you're breathing out, some of those droplets are so small that they may sneak out of those holes and onto other people around you. And then medical N95 respirators. So those are supposed to be reserved for medical professionals. I think you remember at the beginning of the pandemic, there was a huge shortage, and then medical professionals had to keep reusing their mask, and we didn't know what was going on, and it was really scary. So we're trying to prevent that from happening again by just leaving those N95 respirators to the medical professionals. But if you have one at home, go ahead and use it because they're probably going to provide you with better protection. I did want to make a mention of N95 respirators versus KN95. The KN95s, the CDC has actually found that 60% plus are actually counterfeit, and they don't provide the adequate protection that you think they're providing. So they're probably not the best mask for you to use. So this is a chart that shows the risk of coronavirus transmission. So the most risky in the red is gathering indoors. So you're at an indoor concert, maybe you're at a basketball game, maybe you're at a fundraiser like I was 2 weeks ago. And that's a risky situation for you to be there, especially if people are unmasked. The next riskiest would be group gathering outdoors, like an outdoor concert or outdoor sporting event. The next riskiest, or the next on the less severe, following that group, are those that are outside with a small group of people doing some events, like you're walking, running, biking, winds passing by, you're separated. And then the safest is basically you at home alone by yourself, isolating, or you with only close family members, and you guys are taking appropriate precautions, cleaning your hands. If anybody's sick or has been recently exposed to anybody with COVID, place a mask on. So everyone is at risk of getting COVID-19. I think we know that by now, but who is most at risk of becoming very sick or dying from COVID? Well, adults over 65 are at high risk, and people who are overweight or obese, people who have diabetes, high blood pressure, heart conditions, chronic kidney disease, people with asthma, COPD, or other breathing problems, because of course with COVID-19, your lungs could be affected, or usually are affected, and they can definitely decompensate if they already have underlying lung disease. People with liver disease, weakened immune systems, or people with sickle cell disease. And I put certain ones in blue here because I think all of us on this webinar here know somebody who has a little bit extra weight on them, know somebody who has diabetes, high blood pressure, heart conditions. Just think about your family members and how many of them are at high risk of becoming very sick from COVID-19. So since this is a kids focused presentation, I did want to provide some facts on COVID-19 and kids. So very often patients come in and they're like, oh, I didn't know kids could get COVID. Like, I can't believe my kid has COVID. And, I say, of course they can. Children are just as likely to be infected with COVID-19, just as adults are. So there are 28 million children in the United States between the ages of 5 to 11. And since the pandemic began, 2 million of them have been infected with COVID-19. So that's 1 in 14 children. So if you're walking down the street, you see 14 kids, one of them has had COVID. There have been over 43 million cases of COVID-19, and this is data from the American Academy of Pediatrics. And this data, they compiled this on the 23rd, so 2 days before Christmas. So they said there's been over 43 million cases of COVID-19 in the United States. 7.5 million of those have been pediatric cases. And if you look at the percentage, 17.4% of all COVID-19 infections, around that number, since the pandemic began, have been secondary to pediatric infections. And over the week of Christmas, this past Christmas, from the week of December 16th to December 23rd, children did not represent 17% of all infections, but they presented 20.8% of all weekly reported cases. So that's 1 in 5 of all of the positive results that came back to the CDC or to the departments of health. 1 in 5 of those were kids that were positive for COVID-19. More facts on COVID-19 and kids. So the hospitalizations for children are increasing, as I alluded to earlier with those news articles that have been the headlines this week. Hospitalizations were seen to increase with the Delta variant this summer, but they're now increasing with the Omicron variant as well. Illness can be more severe if the child has underlying health conditions. That's something to keep in mind. And then as far as hospitalization, this is what the numbers look like. So somewhere between 2 to 4% of all COVID-19 related hospitalizations are going to be hospitalizations with children. And of those pediatric COVID-19 cases, if a child has COVID, 0.1 to 0.8% of them will be hospitalized secondary to COVID-19. So all these numbers, to me, when I was putting this slideshow together, all these numbers were mumbo jumbo until I put a firm number on it. So I like to think of, the number you'll see in the rest of the slideshow, the number 1 million. So keep that in mind. And then I also like to think of the United Center, because a lot of us in Chicago have been to the United Center. Maybe you went to a Bulls game or a hockey game, or you saw the Chicago Sky play. Maybe you went to the circus, because I think it was there. Yep, the circus was there back Barnum and Bailey when they came around. So that entire stadium at full capacity holds 23,000 people. So if that stadium holds 23,000 people, that means that if you're in a full stadium of 23,000 people and all of them are kids with COVID-19, somewhere between 20 to 160 of them will be in a hospital secondary to COVID-19. So that's the way I like to picture it. So you're at a huge stadium where an NBA team is playing. 160 of those kids that are in those seats are going to go to the hospital and be hospitalized. And a number of them are going to be in the ICU. And then as far as mortality, so mortality overall, this is a common question and a common misnomer. Kids don't die from COVID-19. So the mortality rate is very low for kids with COVID-19, but the mortality for kids overall is low. And since the mortality rate is what it is for COVID-19, COVID-19 now ranks as one of the top 10 causes of death in children. Up to 0.03% of all COVID-19 cases result in death for kids. So again, thinking about that United Center analogy. So if you're at the United Center, it's 23,000 kids in there. The seats are packed with children. 7 of those kids will end up passing away from COVID-19. So it doesn't sound like a lot of kids, but 7, I feel like 7 is too much. These are children. These children deserve a right to live. They haven't lived their full life to their full capacity, and they deserve that. And no one wants to go through losing a child. I'm sure there's probably some people on this call have gone through losing a child. I've had patients or I've worked with physicians who are actively managing patients where a mother or father has lost their child secondary to COVID-19. And the last slide on fast facts on COVID-19 and kids. So children have been found to have both short and long-term health complications from COVID-19. So some of the long-term complications that are special with children are something called MISC that occurs about 6 weeks after exposure to COVID. That stands for multi-system inflammatory syndrome. And basically it means that the virus is causing inflammation of the heart, the lungs, the brain, the kidneys, the skin and the eyes. So the child may develop a skin rash, bloodshot eyes, lots of diarrhea, vomiting, ongoing fever. Those are some signs of MISC. MISC can be fatal in some conditions, and it's a pretty serious condition that you want to take your kid to go to the ER to get checked out for that. Children can spread COVID-19 to others, including at home. And that includes anybody that lives in the home. So if the kids are out here and they get infected, they can bring that home to older adults who may or may not be vaccinated, and other children under the age of 5 that haven't had a chance to be vaccinated because the data isn't out there to show that it's safe and effective quite yet. So in order to protect those kids, it's a consideration to get vaccinated. So we've talked about several different strategies regarding keeping safe with COVID-19, and those include mask wearing, social distancing, hand washing, and the last one is vaccination. So that's what we're all here today about. So we'll spend the last 10 minutes talking about the COVID-19 vaccine in kids. So this is the data that was released from the randomized controlled trials when Pfizer, Moderna, and J&J were emergency use authorized for use. And what they found is that the Pfizer vaccine was 95% effective at preventing severe hospitalization and death secondary to COVID-19. Moderna was about 94.1% effective, and Johnson & Johnson was 66.3% effective. Pfizer is a 2-shot, Moderna is a 2-shot series, and Johnson & Johnson is a single-shot series. So the question is, which one of them should you take? Well, the CDC actually put an endorsement up on December 16th. So just this month, the CDC chose that the mRNA vaccines, they want you to get those over the Johnson & Johnson vaccine. And that's after they looked at vaccine safety, vaccine effectiveness, and the rare adverse events that could occur with vaccination that we're going to talk about. The J&J vaccine was associated with some blood clots, and they felt that the mRNA vaccines may outperform the J&J vaccine. So they have joined the Advisory Committee on Immunization Practices and endorsed the mRNA vaccines over a Johnson & Johnson COVID vaccine. So who should get it? So the CDC is saying everyone over the age of 5, so everyone 5 and older should get a COVID-19 vaccine. And if you're 16 and older, you should also go ahead and get your booster 6 months after completing your first series. So what can the kids get? Kids 5 years and older can get Pfizer. Moderna and J&J is reserved for people that are 18 years and older. So Pfizer has gotten emergency use authorization for kids 5 and older, and full authorization for adults or 16 years old and up. So how do these vaccines work? So a common question I also get is the mRNA doesn't change my DNA, does it? That's just something that the patients always bring up in the emergency department when we talk about vaccinations. So let's talk about mRNA vaccines. Let's talk about DNA vaccines. So mRNA, again, that's like your Pfizer, Moderna. It's a 2-shot series. So what is mRNA? mRNA, your body actually makes it all the time. Your body uses it all the time. It's basically instructions or codes that your body uses to make its own proteins. So your body's been using mRNA before you were even born. Your body used mRNA to create your tissues. It's inside your body, is used up, it's created, it's destroyed all the time and recycled over. So the mRNA was constructed by Pfizer and Moderna to provide instructions to make a spike protein. A spike protein basically is on the SARS-CoV-2 virus. So this is a viral particle here. And on the surface of the particle, you have these things called spike proteins. And this is what makes your immune system recognize the infection. So your immune system will say, what's this thing? Grab onto the virus and say, it looks like a spike. We'll generate an immune response. But unfortunately, in some of those cases, the patient's too severely sick. They have, multiple comorbidities or multiple illnesses already, and the patient may get very sick, become going on mechanical ventilator, or possibly pass away from the infection. So the goal of vaccination is to already have your machinery revved up, ready to go, just in case your body is exposed to COVID-19. So in case, or the SARS-CoV-2 virus, if the virus were to enter your body, your immune system would say, hey, I know you, and kill the virus right then and there. And voila, you protected yourself from either getting COVID or protected yourself from getting a severe case of COVID because your immune system was already there. So with Pfizer and Moderna, so they've created the mRNA, packaged it in this little fat bubble, and then you get it injected into your arm. And these little bubbles will bump up against your cells, get absorbed. That message or mRNA will get absorbed into your cells, and your cells machinery will churn out the spike protein. So it'll read the pamphlet, the mRNA, and it'll turn out something that looks like a spike protein, and it'll present it on the cell surface. Now your immune system, your B cells, T cells, they'll come by. That's your immune system. They'll come by, or part of your immune system. They'll come by, they'll look and say, what is this cell presented to me? And it'll say, looks like a spike. Let's start to build an army to attack spikes in case we ever see it in the future. So that's how an mRNA vaccine produces antibodies for you to fight off the infection later in life. Now, with the Johnson & Johnson vaccine, that's a DNA vaccine. So actually what the scientists did is they created another instruction pamphlet to create the mRNA, to create the spike protein. So it's basically a step before mRNA. You can see the mRNA is here with the Pfizer and Moderna. mRNA is down here with the Johnson & Johnson. So J&J basically took DNA, put it inside of a weak virus, and then that's injected. The virus, this weak virus that does not infect you, it bumps up against some of your cells, and then it gets absorbed into the cell, and it releases that DNA. DNA travels into your cell's machinery. It churns out mRNA. It reads the pamphlet. It says, I'm going to make this mRNA. Makes the mRNA. The mRNA then goes through more machinery. It turns out the spike protein. And again, the spike protein is put on the surface of the cell. Same exact thing happens. Your immune system sees it and creates an army to destroy spike proteins if it sees it in the future. So mRNA has been studied for decades now, many, many years. They've been studied for cancer treatments, Zika virus, influenza, rabies even. And this is not the first time that we've used mRNA within science. And mRNA is being used and really championed during this pandemic because it's faster to produce than the traditional protein vaccines. So this always prompts the question, are the vaccines safe? Which is the next, question I feel like I get from patients. Are the vaccines safe? So the overall answer is yes. So the U.S. Food and Drug Administration, the FDA, they require that all tests for COVID-19 or anything else, all medications for COVID-19, all vaccines for COVID-19 and medical products, they meet certain safety standards before they're released to the general public. And all the vaccines that currently have emergency use authorization or full authorization have had to show that they're both safe and they are both effective. And those randomized controlled trials had 30 to 40,000 people that participated to produce that data that we have. And throughout this pandemic, over the last year that we've been giving out vaccines, we've now accumulated even more data. And that data is from people of different ages, medical conditions, races, and ethnicities. And then that data is analyzed by a panel of experts from different specialties. So you'll see physicians, epidemiologists, scientists looking at this data to give that authorization to use it for the general public. So always remember that the benefits of vaccination greatly outweigh the risks of contracting COVID-19. So why should you get vaccinated? Or why should you get your child vaccinated or your adolescent vaccinated? So it's to stay healthy, right? Prevent COVID-19, prevent severe illness or them passing away from this virus, prevent long-term side effects of COVID-19 and that multi-inflammatory system or syndrome that I talked about. And because hospitalizations are increasing at an alarming rate right now with this Omicron spreading. So with the Delta variant, when we looked at the data from like July to August, September, when Delta was at its peak, what we saw is the rate of hospitalization was 10 times higher among unvaccinated adolescents than fully vaccinated adolescents, which shows that if you're vaccinated, it helps, right? It helps you from being hospitalized. It helps you from developing severe illness. It lets you get back to life activities. If you're unvaccinated, you're 10 times more likely to be hospitalized if you're an adolescent. It's also to prevent spread, right? Because you're going to spread it around to friends if you're an adolescent or an adult too, and you just want to make sure that your kids are safe, right? It's a peace of mind knowing your kids have a layer of protection, at least when they're on their play dates, when they're at after school programs, when they're at camp doing sports or extracurricular activities, or if it's a younger kid, if they're at daycare of some sort. Other reasons to get vaccinated. So COVID-19 vaccines, a lot of this in the news has come up recently about whether or not they're effective, especially with this Omicron variant. So are they effective or are they not? So a lot of vaccine naysayers are saying, see, it didn't work. I told you so. But when you look at the data, what you see and what I'll show you in just a second is that if you're vaccinated, you're less likely to become severely ill. There are breakthrough cases. However, nothing's, 100%. There's no vaccine that's 100%. There's no treatment that's 100%. There's no test that's 100%. So there may be some vaccine breakthrough infections. We saw a mild bump in vaccine breakthrough infections with Delta. However, with Omicron, we're seeing a lot more, which is why a lot of you on this call know somebody right now in your friend circle or in your family that has COVID-19 that's vaccinated. It's because there was a breakthrough infection. However, it's less likely that they're very ill in the hospital on a mechanical ventilator or passed away after being vaccinated. It's more likely that may happen or have happened if they were unvaccinated. So fully vaccinated people with a vaccine breakthrough infection are less likely to develop serious illness. And then even when fully vaccinated people develop symptoms, they tend to be less severe than unvaccinated people. So for me, for example, I've dodged a COVID-19 this entire pandemic. I never got it. I was very cautious, always wearing my mask, everything like that. The CDC told us, like, if you're vaccinated, you could take off your mask. I felt this level of, protection, but with the different variants, you don't know how the vaccine is going to do as far as like breakthrough infections. So with Delta, we saw a small amount of breakthrough. I made it through Delta just fine. But with Omicron, we saw a lot more breakthrough. And I did not make it through without contracting COVID-19. So you're actually talking to somebody who just had COVID 2 weeks ago or got diagnosed with COVID 2 weeks ago. And like I said, some of my family members are vaccinated and some of us are unvaccinated. I went out to a couple of different events thinking I had this layer of protection on me. I was, having some fun, and boom, my throat was a little bit dry in the morning. I said, oh, it's just allergies. Did a swab, it was negative. And then the very next day it had gotten worse. So I repeat swabbed and it was positive. We'll talk a little bit about the testing and false negatives a little bit later. But me and my dad, I'm sure he doesn't mind me sharing, we both probably gave it to him, which is unfortunate. He watches my kid, my daughter, not my kid, my daughter that I love very much. He watches her for me, and he was over here watching her, and I'm pretty sure that he probably got it from me while he was over here watching. And I can't tell you the level of distress that I was in, knowing that I had given my dad COVID-19, who I love so much, who has his own medical problems. But you know what? Both of us were vaccinated. I really harped on him being vaccinated. He didn't want to get it. I twisted his arm. He got it. And, both of us had pretty mild symptoms, just sore throat, cough, a little bit of nasal congestion, and we were back on our feet in no time. I do have another, family member who's not vaccinated who caught it around the same time as us, and they were out of commission for days. And they ended up going to the hospital. I was really concerned about them, and I, remain concerned about other family members or friends that are, unvaccinated, because the data will show you in just a second, they don't do as well as people that are vaccinated. So they don't have that extra layer of protection. My dad's a pretty old guy. No offense, Daddy, if you're watching. So these are our COVID case numbers amongst vaccinated and unvaccinated individuals. So if you look at the number of people that are having cases of COVID, so July, September, August, this is when the Delta variant was at its peak. And what we saw is that fully vaccinated people, stayed relatively healthy. They didn't test positive for COVID. And, there were a few breakthrough infections with Delta. But when you compare it to the people that were not vaccinated, this dark black line here, there were a ton more people getting infected. And I can definitely agree that working at Cook County Hospital, every patient that was coming in there that was really sick, unvaccinated. Unvaccinated patients did not do as well as patients that were fully vaccinated. And then when we looked at the same data around that, same Delta variant, what we found is that when you looked at the incidence per 100,000 people, the unvaccinated 12 to 17 years old. So that's this peak here. So there were really a lot of 12 to 17-year-olds were catching COVID-19 during that Delta variant being at its peak, which is a bit scary, right? Because if you're 12 to 17, you get COVID, you bring it home to mom or dad or grandma, grandpa, or go visit, and they're not vaccinated or they're just older, they're not going to do very well with that COVID-19 virus. That was followed by young adults, 18 to 29 years old. So young adults in their 20s, late teenagers, early, late 20s, they were contracting COVID as well. Here, that's them at this green line, followed by 30 to 40 years old. But again, all these dotted lines are unvaccinated. These are the people that are catching COVID-19. These are the people that are vaccinated here, these solid lines. These are the people that are catching COVID-19 despite being vaccinated. So the numbers are significantly different. Now, when you look at the deaths secondary to vaccination, what you find is that older individuals greater than 80, right, very elderly, unvaccinated people have the highest mortality rate, followed by unvaccinated 60s to 70s-year-olds, followed by unvaccinated 50 to 60-year-olds. 60 years old. You see this solid line here of vaccinated people, but this is fully vaccinated 80 plus years old, but very, very elderly people. But the trend I want you to notice is that unvaccinated, 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 these are their mortality rates. This line here is mostly of your fully vaccinated people. Vaccines are out here saving lives. They're keeping you from being hospitalized. They're keeping you from catching COVID. They're keeping you from dying or having severe illness secondary to COVID. And if you want to see which vaccine, performs the best, so this is unvaccinated again. The people that are catching COVID, these are COVID cases. This is your J&J vaccine. So there are more breakthrough cases with J&J, followed by Pfizer, followed by Moderna. So Moderna is the solid leader here throughout the Delta variant that we're seeing that's performing a little bit better than Pfizer. But if where you're going to get your vaccine only gets Pfizer, or you can only get Pfizer, get Pfizer. If the only thing you have is J&J, get J&J. That's what the CDC is recommending right now. They just want you to get vaccinated, but they're preferring that you get an mRNA over your J&J vaccine. So this is Dr. Susie Lopez. She also works with Impact. So she got her vaccine early in the pandemic as well. Some of the most common side effects we're going to talk about, and then we'll end the presentation for a Q&A. So most of the common side effects are redness, swelling at the site, a little bit of weakness, fatigue, fever, muscle aches, headache. Again, this is not you getting COVID. A lot of people say the vaccine gave me COVID, or the flu shot gave me the flu. That's not what happened. What it did is it revved up your immune system. You had that response because that's the way your body responds when it sees an invader. So if you had gotten infected with COVID, you would have got those exact same symptoms, but you would have got them worse. So basically that is your immune system's way. It sends inflammatory, it inflames the area, it sends cells to that area, it swells the area. That way that area has increased blood flow, it has increased cells to get there and fight that infection. That's the reason your arm hurts. That's the reason you're feeling weak and fatigued, is because your body's doing what it needs to do to create an immune response, to create that army that it needs to create. And those symptoms only last somewhere between 1 to 3 days, and then they go away, typically. Tips to decrease side effects: if your child is vaccinated, apply clean, cool, wet washcloth over the area, use exercise, massage that area, and then to reduce discomfort, drink plenty of fluids, dress lightly so nothing's squeezing that area, and then you can talk to your child's doctor about using Tylenol or ibuprofen to decrease the discomfort or fever if your child has one. So those are very, common side effects that you have after the vaccine. There are some serious but uncommon vaccine side effects. But serious side effects have been shown, when you look at the data, to happen within 60 weeks of receiving a vaccine dose. So what the FDA did is that they actually monitored people when they did the initial studies. They monitored people for 8 weeks after the final dose, just to be extra sure that there wasn't going to be any long-term health problems or low risk of developing long-term health problems. So typically we see those 6 weeks after getting a vaccine when you're doing studies. The FDA looked at 8 weeks of data before saying, hey, we're going to release this for emergency use authorization. It's looking pretty good. And very importantly, the CDC is continuing to monitor the safety of COVID-19 vaccines. So a lot of you wanted to watch and wait. It's been a year now, and there's data on, on how the vaccines have done with our vaccine adverse event reporting system. And I'm going to share that data with you right now so you can make your own informed decision. So once you get your shot, you can download this app called vSafe. So it goes onto your cell phone. And basically, they just ask you like, hey, have you had any symptoms? Check with vSafe today. And you pop in if you've had a fever, chills, et cetera, so forth, or anything crazy that's going on. You can self-report it to the CDC, and it marks that as, hey, there might be an issue with the vaccines. So I'm going to share some of the VAERS data with you in just a second. I did want to amplify that there have been 496 million doses of the vaccine being given over the past year. So that's a lot of data to look at. So we're going to look at some of them now. So these are the serious but uncommon vaccine side effects. Every single one of them are very rare. And again, I'm going to use that United Center analogy. And I hope that works for you, because somebody at work said that it worked. So I'm just trusting this other doctor I talked to, because I was like, I don't know. But the United Center holds 23,000 people. So in order for you to get to 1 million vaccinations, 1 million people, or 1 million shots, you've got to go to 43 packed Chicago Bulls games. You got to go to 43 of them to get to 1 million people. So if you go to 43 games, what you see is that, and everybody got a vaccine dose at every game, you need to go to 43 of them for you to see 5 people that have a severe allergic reaction. So it's very rare to have a severe allergic reaction. If you do, they have treatments to help you right there on site. And also, you shouldn't get another dose of that same vaccine, or say if it was a type of mRNA, don't get another mRNA vaccine. If it was a J&J DNA, don't get a J&J DNA. For blood clots, same kind of data. So you would need to go to 43 games at the United Center. So to see a professional basketball game in a packed stadium, you got to go to 43 packed games to see 4 people get blood clots. And what the CDC saw is that they were associated with the J&J vaccines. Now, when you look at the data overall, the numbers are 54 people out of 16.4 million people that got J&J vaccines developed blood clots. Unfortunately, 6 people did pass away, and that was associated with the blood clots. But again, that number is very small in relation to the number of people that got it. So the CDC is still recommending for people to get vaccinated. But because the risk of catching COVID-19, there have been many more deaths secondary to COVID-19 than there have been secondary to getting the vaccine, or in relation to, or in close proximity of getting a vaccine. But again, this data is why the CDC came out and said, hey, we want you to get the mRNA, and that's where our recommendation is right now over J&J. The other two is that heart muscle inflammation and Guillain-Barré syndrome. So heart muscle and heart lining inflammation is very rare. Again, 43 games to see 22 people get it. And Guillain-Barré is a condition where it's usually seen after a viral infection, but it's when your body starts attacking its own nerves. And again, 43 games to see 16 people get Guillain-Barré. And Guillain-Barré can cause weakness, numbness, tingling. Some of those can be transient and some of those can be permanent. Okay, this is the United Center. This is 23,000 people capacity. Again, 43 of these games to reach 1 million people. So were there any deaths reported to VAERS? So this is very significant because there have been some deaths reported to the vaccine adverse event reporting system. However, there's a huge caveat that needs to be bolded and highlighted and put in red lipstick. FDA mandates that physicians report any death after a vaccine to VAERS, and it doesn't have to be the time period is not exactly, it's not spelled out on the internet. I did try to find that data. Like, is it within 30 minutes of the vaccine, or is it within 30 days of the vaccine? Because that makes a complete difference, For example, like Bell's palsy was something that a lot of people were saying, oh, with the vaccine, you get a facial droop because all these people in the study got a facial droop. Well, when you look at the people that got the facial droop in the study and you look at people who got a facial droop in the general population, the number was the same. The people would have probably gotten that facial droop with or without the vaccine, because that was the same rate that it occurred in the general population. So again, this data doesn't mean that the death was directly associated with the vaccine. It just means that the physician had to report it because the patient had gotten the vaccine within any type of, within the reported type of time period. So they were mandated to report it, even if the physician did not think it was related to the vaccine at all. If the physician thought the patient had a heart attack, or the patient had an infection for the last 2 months and the infection probably, finally took over and did what it was going to do, they still had to report that patient's death to VAERS because the patient ended up getting a vaccine at some point. So the number, when you look at that, is 22 people for 1 million. So 43 games at the United Center, 22 people. So 10,000 out of 459 million vaccinations in the US. And that percentage is 0.0022%. So those are the numbers there for you to make your own decision. So the question is, should you still get vaccinated knowing these side effects? Overall, yes. Everyone 5 years old and older should get vaccinated because the risk of COVID-19 way outweigh the rare adverse reactions that you can get. And a quick word on variants. So what is a variant? It basically is a change in the spike protein, causing the virus to be spread more easily and cause breakthrough infections. Continue to mask, continue to use social distancing. This is the Delta variant. It was discovered this summer, 2021. They had some breakthrough infections, but again, it was pretty well taken care of by our vaccines. Omicron variant, we're seeing a lot more breakthrough infections with this one. However, symptoms have been found to be milder. We don't know if that's because most people are vaccinated, so the vaccine's doing its job, or if it's just a milder variant. So they're still looking at that data right now. And just a quick word on testing and quarantine. So the test, if you test positive, you want to isolate for 10 days. However, CDC just released data like 3 or 4 days ago that said if your symptoms resolve after 5 days and you're asymptomatic, you can discontinue isolating early and then just wear a mask for the next 5 days just to make sure you're safe and people around you are safe. And if you're exposed to COVID, what do you do? So let's say you were like my family, where there was a funeral and someone went to the funeral and had COVID. So now everybody's exposed. So what do? So if you were unvaccinated and you went to this event and somebody had COVID there, or you were greater than 6 months, you never got your booster, it's been more than 6 months since your last vaccine series, then you should quarantine for 5 days, followed by 5 more days of mask wearing, just to make sure that you're not going to get sick or get anybody else sick. If you absolutely cannot quarantine, then just wear a mask for 10 days. If you are vaccinated, boosted, up to date on your shots, just wear a mask for 10 days when you're around others. You don't need to quarantine at home. And a word on testing, like I said, I was negative on the first day of symptoms, positive the next day. So testing should occur on day 5 to 7 after exposure. However, keep in mind that you're most contagious ranging from 2 days prior to your symptoms even starting up to 2 to 3 days after symptom onset. So that's like the peak of infectivity. So you don't want to be around anybody. So that's why mask wearing is so important, even when you're in closed spaces or even when you're in outdoor spaces, especially if the transmission is high. So the CDC has changed their mask wearing recommendations to, just because you're vaccinated doesn't mean you can take your mask off. It really depends on the transmission in your area. So if you're a hotspot like the entire United States is right now, you should really keep your mask on despite you being vaccinated, because the breakthrough infection rate is so high. Also keep in mind that false negative results may occur, and you should just retest 24 hours later like I did, just to make sure you don't have COVID before you go to any type of social event. So here are some lists of some resources that I can give to mean girls. So this is how do you find a location to get a vaccine near you. Very easy. Text your zip code here, call this number, go to vaccines.gov. This is what I did. Very, for a friend, very easy to find him a vaccine within like 30 seconds. Other resources, cdc.gov, to get more information on COVID-19. They've really beefed up their website since I checked maybe 6 months ago. And then Impact for Healthcare. Again, Impact has a lot of good information on their site. And if you really want to look at the data from randomized clinical trials, you can find it here for Pfizer, Moderna, and Johnson & Johnson to make your own decisions. So, and that's about it. So I'll stop sharing my screen now and we can take some Q&A. And thank you so much for listening to my presentation.
Wow, Dr. Hamid, that was absolutely wonderful to really take us through the journey from the trials to current day, understanding our surveillance information, our vaccination numbers, and even giving your own personal story. We still have a crowd. We're going to go probably if everybody can stay on for about 15 more minutes. We do have questions and we want to be able to answer these questions appropriately to keep you guys informed so you can make your proper informed decisions. I want to go back to something we said a little earlier. What happens when folks say, well, hey, my child had COVID-19. They have antibodies now. What's the point of getting vaccinated? How do we talk through the parent that says, they already had it, we're good, their immune system is great now because they have those antibodies that the vaccination produces?
Yeah, that's a great question. I get that one from time to time. So actually, at first there was a paucity of data where we didn't really know. But now when we compare people who have had COVID-19 and have that natural immunity, that natural immunity is not as strong as people that have been vaccinated. So it's still recommended that child get vaccinated. And you can talk to your primary care doctor about when to go ahead and do that.
Awesome. I have a couple folks that got one question that says, my child is turning 5 next week. Should I wait a couple months to get their vaccination, or should I say, okay, they're 5, they meet the threshold and go get vaccinated?
That's a great question too. So if you're thinking about getting them vaccinated, go ahead and do it. I mean, the Omicron variant, the hospitalizations are going up right now. So this is the best time to protect yourself. So I would get it as soon as possible. If it was my 5-year-old, but it's your decision at the end of the day.
I think that this is also a conversation that we hear a lot when we start talking about and we see the outcome related to what the city of Chicago and Cook County is trying to do. When folks say, well, my child is not vaccinated, But we're only affecting us. We're not affecting nobody else. It's our prerogative, which it is. It's our right. But they're still going to school and things of that nature. So I think, what's the conversation do we have with that parents that says, well, it's I'm only affecting me. I'm not hurting anyone else by not getting vaccinated.
Yeah, I mean, but that's how COVID basically mutated and spread, right? So when it has the opportunity to linger on in environments and communities that are not vaccinated and pass from person to person, it has a higher rate of it transforming, right? And becoming like a different variant to go back and infect the people that have gotten a vaccine. And I totally understand that thought process of like, hey, I'm not harming anybody else, but if you are the person that's unvaccinated, you're more likely to carry that virus and have, high viral loads on you, and then infect others around you. So you're doing yourself a service, and then you're also doing the people that you love a service too if you go ahead and try to get that extra layer of protection.
Awesome. Thank you. Another question that came in that says, the person said they're fully vaccinated. They have not received their booster, recently tested positive. What's that waiting period to get the booster for them?
That is a great question. I actually meant to look that up just to be sure that I'm absolutely sure talking on a webinar. But I believe that it's not 6 months. I can't remember. I can't recall. I'm sorry. I did not look that up, but I can look it up for CDC and kick it to you all for sharing whenever you share this video.
Awesome. Yeah. And I think that's a great, especially like we just said, we know that the numbers are rapidly going up and a lot of people are vaccinated. So again, encouraging, as much as we're encouraging the pediatric vaccination for folks that are fully vaccinated and have not received their booster, please, please, please consider getting your booster. Another question is actually, again, for you, Dr. Amid, just saying, this person says they work in a high frequency area, and how do you decontaminate yourself when you come out of the ER? Just they're saying, what are your methods, just so they can think of them and maybe potentially use them to stay safe?
Okay, so my method was a little bit, it wasn't crazy. I think everybody else was doing it too, but I lived in an apartment at the time. I just moved to this house. But I lived in an apartment and I actually just took off all of my clothes in the apartment. If my neighbors were outside, I was like, hey, I'm in healthcare. Not all my clothes, but like the outer layers of my clothes, because I didn't want to bring them inside. And then I also wiped down my shoes, just being in healthcare, because you just don't know what you're tracking into your house for your kids to drop something on the floor and pick up and things like that. But now, since I've had my vaccination, I'm feeling a little bit more comfortable after 2 years of being in this pandemic. What I do is I come home, I leave my shoes at the front door, and then I go immediately to the shower, take my clothes off, throw them in a dirty bin, and I immediately shower just to make sure that I'm getting all these COVID particles off of me. And then and only then do I pick up my daughter and basically give her hugs and kisses.
Awesome. Awesome. I mean, we're like, got to do what we need to do so we can just get back to, like I said, lots of hugs and kisses. So another question says, someone says, I use face shields at work. Is that enough protection?
So the CDC, that's a great question too. So the CDC actually says that no, it's not enough protection, because there's not enough data to show that face shields are superior to masks, et cetera, so forth. So they don't recommend that you use only a face shield. The face shield is useful for you to keep droplets from getting, in your eyes. So my personal thoughts are, if you're at a restaurant and you want to use a face shield while you're eating to make sure the person across from you isn't spraying droplets on your face, kudos. But it shouldn't be the only protection that you use, because when you're speaking, droplets are still dropping down, and then you still have very small droplets that can seep out the sides because it's not a tight, snug fit.
Awesome. So we just have a lot of comments. Again, thank you guys for staying engaged. I just want to hit on one of them. We're basically saying, COVID is nothing but a new bad flu. It's not Ebola, it's not SARS. So again, how do we stay in the mindset to maintain our safety, and even if we do consider this a bad flu?
Yeah, so COVID is a lot more than a bad flu. So with COVID, we have never seen healthcare the way that we've seen it now. So COVID doesn't just cause respiratory infections and symptoms. COVID causes a myriad of different issues and diseases that flu doesn't. COVID has been linked to blood clots themselves, and we've had people pass away from blood clots weeks after catching COVID. It's been linked to heart attacks, so people will have a heart attack, the clogging of their coronary arteries, the arteries that feed the heart, secondary to a COVID infection. They can also have strokes secondary to COVID, skin rashes, things like that. And you can also have that inflammation or that of the heart lining or heart muscle that I talked to you about. That was a very, very rare side effect of one of the COVID vaccines. With that, you can actually get that with COVID as well. And it can cause long-term myocarditis. You can be on oxygen for an extended period of time and possibly for the rest of your life. You can have fibrosis in your lungs. You can have fibrosis of your heart tissue, making it so that you can only take a couple, steps before you're winded and short of breath, and significantly limit the things that you're able to do in your everyday life. So COVID is completely different than a flu. Again, we've not seen anything within, my lifetime or some of like the older attendings that work with me at Cook County hospitals in their lifetimes, the way that we've seen COVID ravage body systems. So the big overarching answer is that we don't know the long-term side effects of COVID. And, I felt very, when I caught it, I said, dang, shoot, I'd rather go with a lot of people are saying there's long-term side effects of the vaccination that, we really haven't seen that much of anything yet, aside from those numbers that I showed you. But I really thought, shoot, I really don't want fibrosed lungs and heart disorders and disease later in life because, I caught an infection 10 years ago. So keep yourself protected.
Awesome. And I want this last question. So again, a lot of folks are, again, as they're trying to decide, should I get my teenager vaccinated or my preteen vaccinated, is folks are saying, we see stuff on social media and people read things and they're saying the vaccine may affect puberty or cause infertility. We know some stars have put that information out on the wide web and folks are saying they're catching on to that. So what do we have to say about the science with that?
So there's been absolutely no data pointing to you being infertile, secondary to a COVID vaccine. There have been some issues with erectile dysfunction, though, in relation to COVID infection, so COVID-19 infection. So if you're worried about infertility, sex life, things like that, you can have some dysfunction that's been shown to be secondary to infection. And then the other answer was for, it was a two-part question, correct? Oh, Nicki Minaj. Sorry, I just wanted to say Nicki Minaj's friend had something else. I don't know what was going on, but it was not COVID. I just wanted to say that. But no, it's not a concern. And, a lot of pregnant women are concerned about COVID as well and getting a vaccine while pregnant. And just wanted to segue into that the catching COVID-19 while pregnant has been shown to be associated with preterm delivery. So early, having babies too early. Major health organizations are recommending that pregnant women get vaccinated as well.
Awesome. Well, Dr. Hamid, it has been an immense pleasure to be the moderator today. We thank you for your overview and really digging into our thought process and making us understand the science. So many times, again, we're hearing these things and we're saying what's positivity rates and what are these different side effects and how they all play together. And you really did just give us a very good picture. I love the United Center analogy, and I'll be using that. So I am going to take that with me also and use it in my day-to-day work. So I also want to give so many kudos to our audience, our participants. Thank you for being engaged on Facebook Live. Thank you for being engaged on YouTube. We are so happy to have you. And we hope today's conversation has been insightful. In 2022, we have an abundance of meaningful events just like this one under the Mean Girls Empowerment hat, including our annual vision board party. Our girls love this. They say, write the vision. And this is our opportunity to create our vision boards on what we see and what we want to produce in 2022 and beyond. We have a health symposium coming up. And if you're not aware, we are raising funds for our 15-passenger van to support all of our community efforts in Mean Girls Empowerment. So stay connected with us. Don't let this be the last time we see you. Again, if you haven't already, subscribe to our YouTube channel, go on Instagram and follow us. Stay connected on Facebook and Twitter. Again, on behalf of Shatina Edwards, our CEO and founder, our board, our NG staff, we would like to wish you guys all a happy and prosperous new year. And I'll leave you with one final thought. In the words of the top doc of the Illinois Department of Public Health, Dr. Ezike, she said, get vaccinated, get boosted, and stay masked. Thank you so much and have a great day, everyone. Thank you.